Look, we've had a question on the website around someone a bit confused about their invoice from a home care provider. I know we've been doing some work with a couple of clients on this very topic, so I thought it was a good one to just explore a little bit more. When someone gets their monthly budget and invoice, what should they see and what should they be looking out for?
That's a really good question. What should they see? What they will typically see, Whenua, is a sea of letters and acronyms and alphabet soup and numbers everywhere, guaranteed to give you a headache. These invoices that you get from either a home care provider or an aged care facility, they typically happen every month. And it's a bit like, Whenua, when you get your super statement for the year. You have a quick look at it and it gives you a headache, and you just either file it in your filing cabinet or you file it in your bin. Maybe your pay slip's a bit like that too, although your pay slip is a bit more important because it's the bottom line going into your account that's really important. But where I'm going with that is those documents like super statements and pay slips and all that sort of stuff, they're all very important documents, and you really should have a look at them and really understand what they're saying to you and make sure that they're right, because at the end of the day, that's your money. And I give that example because it's exactly the same when it comes to these invoices you get from either a home care provider or an aged care facility, because they are confusing and you really do have to sit down and absorb them and understand the terminology, and sit there with your calculator and do the maths and make sure that the hours you're being charged and the hourly rates are all right. That's really important because at the end of the day, that's your money. So making sure that what you're getting is correct is very important. And it's like anything in life, we're all human. We all make mistakes. I make more than most people, but things happen, and systems sometimes inside an aged care facility or a home care provider with their financing systems can be a little bit loose, or things go astray and invoices go out incorrect. So really,
I would do agree with that there's often quite complex systems that sit behind this, and behind those systems sit people, and errors happen. Mm-hmm. Yeah. Very important point.
Yeah, so sitting there and really going through those documents, especially, in the first few months when you're maybe going into permanent care, or the first time you've got a home care provider providing services, the first 3 to 6 months, really important to make sure that what you're getting is correct. And, I've sat with families before, Whenua, as you know, and had a look at things and just found mistakes, and that's all they are, they're mistakes. And sometimes they can be very costly mistakes. Yeah. So hopefully that's sort of explained a little bit. Yeah.
Yeah, absolutely. And it's probably worth pointing out that these mistakes often aren't intentional, and that providers are setting out to do wrong by anybody. That just these mistakes do happen, and if you're not aware of what to look for, it's quite easy to miss them.
That's right. That's really. Really good point, Whenua. None of this stuff is done deliberately, but we sit with families and we go through those invoices, especially over the first few months till things start to settle down a bit, and just check them. And I'll be able to point out to people what to look for, what numbers sort of they should be looking at. It's just really important to really understand that, rather than just get the statement like we did with our super statement or a pay slip and just file it in bin.
Indeed. That's been really helpful, Shane. Thank you.
Thanks.
But yeah, absolutely. If you're not sure, get in touch and we can help you out there.
Great. Yes. Thanks, Whenua.